Hey guys, it's Dr. Brandie Keats with another episode of Pregnancy Pain Sucks. Today, what I want to talk to you about is stuff that I haven't really talked about, and it's not salacious or weird. It's just so commonplace to me with what I've been doing over the last 24 years that it's not something that I talk about. What I do, and a typical woman that I take care of, is a certain presentation. And for a lot of people, when you don't understand a certain sector, like for me, when my child was diagnosed with autism, there's people like Karen Fox, who runs the mainline special needs group, that's like, of course you feel this way, or of course this is happening, and can sort of lead you through that process. For a lot of women who are pregnant, part of the reason what I do is the stuff that people don't tell you is like, yeah, that's what happens. And over the next year, I want to talk about, like I said, the softer side of things with pregnancy that really cause disharmony within you, or that can cause you issues or trip you up, that I see again and again and again. I remind you that for the last 24 years, I've been doing almost exclusively pregnancy. I don't have a practice where some of my pregnant patients are there. Like most everybody in my office is pregnant, or they're a tiny baby. I did go an extra year with the FICPA, with the ICPA organization in school, postdoctorately, to study pregnancy in infants. And I think it's really important to highlight that, because when you see something again and again and again and again and again, a lot of times you don't talk about it. So for me, I wanted to talk to you about a classic presentation where I'll get a patient in and they think that they're the only one. And that's very isolating and scary because no one talks about this. So let me talk to you a little bit today about a typical patient that I see. So the typical patient that I see on a first pregnancy is pain that starts around 32, 33 weeks, where they've been uncomfortable, they've been in pain, they have some lower back pain, they shrugged off some upper back pain when they first got pregnant because their chest got bigger. People don't understand or have that explained to them, that when you first get pregnant, your chest gets heavier and that puts on a new type of load to your back. Just like if you had a new pillow or a new pillow topper or a new chair at work or new shoes, any small change in what your body is used to, it's going to react, right? And a lot of times you won't chalk that up to being like, oh, that's due to pregnancy because my chest is heavier, it's pulling me forward. So I've done some videos where I've strapped on a very heavy belly to show people what that looks like. But the same thing is with pregnancy. The obvious stuff happens with the first pregnancy that I'm going to see. They expect that they're going to have lower back pain. They may not expect that it's going to go down their leg, which is typically caused by the piriformis muscle. It can be a form of sciatica. It's not truly sciatica because it's a branch of the sciatic nerve getting pinched because of the anterior weight. So let me say that in English. Because you're heavy in the front, because you're carrying more weight in the front, one of the muscles in your butt pinches down because it's bracing you from falling forward, from being pulled forward. And that pinches a branch of the nerve that services from your spinal cord down to your leg. That is called piriformis syndrome. And that is very common. That's the stuff that you expect. But I think that women think it's going to be like period cramps. They have lower back pain, but they don't expect when they have what feels like a fist in their butt. They're sitting on something weird and it goes down their leg. That's the shocking thing that women get, that they're like, oh, I kind of expected this, but I didn't expect it to be like this. The other thing that can happen on a first pregnancy, especially if you're carrying a lot of fluid, is wrist problems, where women will get swelling in the wrist. Again, it's something that they're OB a lot of times. They'll shrug off and just chalk it up to something that's completely normal for them. It's not normal. It is treatable. Both of those things are treatable. They're not something to be shrugged and expected, right? The part that I'm really talking to you guys about, and where my work has really settled, is where women have a second pregnancy and they don't expect, hence the name of my first book published in 2018. If you're watching this, you can see Daisy's ears poking up. I have 3 dogs sleeping under my desk. But second pregnancy stuff is what we really start to see. And that's what knocks women off guard. Like for me, I can say I breastfed my first child for a year. Easily, wasn't a problem, was a great experience. Second child was born over 6 weeks early, was not exactly cooked the whole way, didn't have the mechanics or the tone to be able to breastfeed. Hence, I met Jackie Kelleher. Huge fan of her. But I thought I knew it. I thought I knew what to expect. I thought I knew how it worked. And when it didn't work that way, it was sort of shocking. It was like, oh, I got this. It's like riding a bike, right? And it wasn't. So for me, I think most of my work is geared towards that second pregnancy where someone had a first pregnancy. They kind of know the ropes a little bit, but then it goes off the rails. It's like, why is this happening? So second pregnancy, what I typically see is debilitating stuff because they ignore it. I think, oh, I overdid it somehow. I walked in Target in the wrong shoes, or I picked up my kid and now I have this horrible back pain. What they don't expect is the pubic pain that they get, that they might have had towards the end, which was easily explained when your baby's the size of a bowling ball. But when your baby is the size of my phone, that's not understandable or explainable unless you understand what happened. And I've done a lot of videos with you guys where I show the pelvic floor and how important the pelvic floor is. There is so much to the pelvic floor that we don't understand and that we haven't talked about, of why when it doesn't operate the way that it should, or it was damaged in ways that you didn't even think about when you were a teenager, when you were doing dancing or horseback riding, or you were a high-level athlete, that you were essentially trashing your pelvic floor or your knees. The knees were more, I see more with teenage girls with knee problems that are high-level athletes. But you don't realize at the same time, you're trashing your undercarriage. You're stretching out ligaments that we know with ligaments, they stretch and don't stretch back. So when you had that first pregnancy, your body is stretching in ways that has never stretched before. The baby sort of stretched, the first baby stretched that pelvic floor out. You did not do the rehab that you thought you needed, knew you needed. No one suggested that you needed to get evaluated for, which is why I bring all my patients back after they have the baby to assess their pelvis and then recommend a pelvic floor therapist who can internally check them. It's really important. Your body went through something major. So when somebody comes back at 5 months and they've been struggling for a month and in debilitating pain and tears, they don't understand that that's extremely common. Y'all know my famous line that pregnancy pain is common. It's not normal, but it's totally predictable. If you have pubic pain on your first pregnancy, it's critically important that you get into a chiropractor, you get into a pelvic floor therapist, just with the same veracity that somebody does that I see after they VBAC. A lot of women will come to a chiropractor proactively and say, I'm going to do it right this time. I'm going to make sure that my structure is lined up, because we know that structure lends itself to how well you do when you have a baby. So if you have pre-existing hip problems, lower back problems, typically you won't have pubic problems, but if you have groin pulls, if you're an athlete, you've had groin pulls and you've had low back pain, that's a high indicator that you're going to have an issue because you're putting weight in an area that's already stressed and not performing right. So it's really important to get evaluated. So second pregnancy, as I said, typical patient is someone that had an easy breezy, stereotypical first pregnancy with a little bit of low back pain, a little twinge because their baby was big and they thought that that was the pressure in their groin. They might have had some swelling in their wrist, but that second one that takes you off guard, and it's actually scary. I think that the part that people can talk about and then they don't get, just like when I almost lost my child at 17 weeks, when I was pregnant with my second, is you don't expect not being able to work. You don't expect not being able to function. You don't factor that in. And when you don't factor that in, it causes fear. It causes anxiety, because it's like, how am I going to be able to do this for the next couple months? So what I want to bring awareness to, like I said, is the feelings and the symptoms. They're totally unrelated, but related. Because if you can realize that this stuff happens all the time from somebody that's been in the field for over 24 years, who sees patients all the time, who's evidence-based, this is common. This is not something to be scared about. Why I've designed courses, books, why I do what I do is to help you through it. Because if we can help athletes get back on the field, we can help you with your own rehab, with your own therapy, with the things that you need to stop doing and start doing. That's why I've created courses. I have the books, but books are flat. I think a lot of learning is visual. A lot of learning is storytelling. A lot of learning that I've done is what I've chosen to do is develop the villains of pregnancy. And it doesn't fit my branding. I've rebranded with the help of Leslie Clearwater. She has a great eye. She owns 10 Air Studios. She's a very good friend of mine. She helped co-write my book about partners because she has such an amazing partner, and I really didn't have the experience to talk about how to do it right. I knew how to do it wrong, but she was extremely helpful because she has an amazing partner, Seth, but she also has an amazing eye. And the branding that I'm coming out with is pure, and in the past, it's been over the top and flashy, and that is not me if you know me at all. I'm very Eddie Bauer, very plain Jane L.L. Bean type of person. So the branding fits now. It's not showy. It's just quiet and clean and concise and stunningly beautiful. So a lot of people have asked me why I've decided to use villains why I've decided to use villains when teaching. The reason I've chosen to use the villains is when I am in practice, I like to bring humor to stuff. And when I teach, I can put an archetype of a typical person that has this, or what the villain is thinking, or why she comes to town, and make it humorous so that you're like, oh yeah, that's Peggy pubis if you have pubic pain, or oh yeah, that's Rebecca rib pain. It makes things less scary. I learned that from Anthony Robbins. Anthony Robbins was saying if you could take stuff that's fearful and cartoonize it, characterize it, I don't know what the word is. If you can take your boss, if your boss is like yelling at you, if you can turn them in your head into a cartoon, it makes them less scary. And if I can give you an archetype of what that presentation looks like, you can associate it with a character. And that's what I've chosen to do with the villains of pregnancy. So if you've bought my work, and a lot of people love the villains, but it doesn't match the branding, that's what I'm doing. I'm taking you into another world where you can associate with a type. Because what the thing I want to do this year that's the most important is to see you. If you're searching on the internet, so many people are searching for answers about what's happening in their body. They don't know what's happening in their body because people do not talk about the realities of pregnancy because they're afraid it's going to scare people, or it's going to frighten people, or it's going to make them have something that they don't really have. If we can talk about it and normalize it, right? It's not normal, but we can normalize that there are problems during pregnancy and that they are fixable. I've, again, made archetypes for learning purposes only, for humor purposes only, because that's what's worked in my practice to humanize things that are painful. And I've talked before at the end of the year, talking about how I bring humor to painful situations because that's my way of controlling it. I'm not going to let something put me down without making it humorous. And is it funny to me? Really? No. So I've started to honor that part of, yeah, that made me angry, or that made me sad, or this is really scary for me. But at the same time, while going through it, what gives me the bravery to go through it is humor. So if you've seen my work, if you look at the stuff that I put online with Peggy Pubis or Linda Low Back Pain or Sally Sadika, who incidentally are named all after family members, know that that's what I'm doing, is just using the best practices with education of storytelling, archetypes, just to anchor your learnings. For when I teach other doctors, that's what I'm doing. And that's what I hope to do with you, that you could joke and just say, oh, damn, that's just Rebecca, or man, Peggy is really biting today. So that's what I do. If this is your second pregnancy and you're searching online and you find my podcast, I'm telling you, there's certain things I'm going to talk about this year. You're going to be like, damn, that was me. Why did nobody tell me about that? Why did nobody give me a heads up? Kind of like after you have the baby, there's a very good chance you're going to end up with pain in your upper back and neck, going down your arm if it's really bad, or a stabbing pain, and you're scared. Why not tell people, yes, this might happen, and this is how you fix it? when we don't talk about a solution, I think that that's when things get scary for people. So over this year, I'm going to be talking about all of it, the feelings, the sensations, the physical symptoms, what the presentations are. So again, to recap, what I typically see in practice for a first pregnancy is typical stuff. Lower back pain that you expect, maybe a little bit of sciatica, man, it's really bad, and a little bit of pubic pain at the end. Again, blaming the weight of the baby and the size of the baby. Where my focus is and where I really want to talk to people is that second pregnancy where you were able to do it all in your first pregnancy and now you can't because you have another baby that you need to take care of, that you're lifting. You are older. Your pelvic floor is stretched. It doesn't mean that there's things that we can't help you with to navigate it, because the reality is you're in it. So let's make it the best that we can. So that's my goal over the next year. If you could comment about something that was unexpected, if you see this podcast, what was unexpected to you, that you can help another woman through this, not to scare them, not to frighten them, but just to say, hey, this is what I had, and maybe something helpful that was helpful for you to get through it. So again, this is Dr. Brandie Keats talking to you on Pregnancy Pain Sucks. I'm going to tell you how to fix it this year. I'm going to warn you about it. So if you're searching, it's late night, I'm here for you. Use my stuff as a reference for you to help you through this most beautiful time, this most hard time, but we're going to get you to a good place. But again, Dr. Brandie, Pregnancy Pain Sucks. Take care.